Hi there. I hope you're all doing good. I wanted to chat with you a little bit about heartburn tonight. As you know, I'm Dr. Shiroko Sokitch, the owner of Heart to Heart Medical Center and the author of the book Healing When It Seems Impossible: 7 Keys to Defy the Odds. And I'm here tonight to talk to you about heartburn or GERD. I have a really high success rate in helping people deal with heartburn, and it's a much bigger deal than we think it is. You know, over 30% of the population has heartburn at some time in their life, and there are lots of complications when you have long term chronic heartburn. A lot of people think it's just something simple like taking a Tums and making it go away, and then, maybe a few days later have to take Tums again. But there are some people who have to take medication every single day. And if you've had heartburn for a long time, or you get chest pains at night that wake you up or keep you from sleeping, it's not uncommon. Women who are pregnant commonly get heartburn. Even babies get heartburn. So it's a common and complicated problem for some people. And I wanted to talk a little bit tonight just about the medications that you might end up on and what the dangers are of staying on those medications for too long. Most of those medications are short term, and they're meant to be taken just for a short period of time. I have a patient who recently started having GERD symptoms at night, and it's a pressure sensation in her chest. And her doctor told her only to take the medication for 2 weeks. So it's not something that you're supposed to take for, really long periods of time. And so at some point, if you have heartburn and you've been taking medication for a really long time, you should start looking at other options. I'm going to talk to you a little bit about what the possibilities are for taking medications. I'm just going to set comments here so that people can comment if you want to. Yeah, okay. Well, okay, so there are basically 5 different types of medication that people can take for heartburn. One is antacids, and antacids are things like Tums or Mylanta or Maalox, and all of those are fairly simple. They just basically stop you. They're sort of counteract the acid in your stomach, and if they work great, you can do baking soda as well. And the side effect is really Maalox is got aluminum in it, so if you were to take it all the time, you could potentially get aluminum toxicity. With Tums, it used to be given as a calcium medication because it's made with calcium carbonate, and so some doctors used to tell patients to take Tums as their calcium, which it does not absorb very well, so I wouldn't recommend that as a form of calcium, but it's not particularly harmful if you're going to take it as an antacid. The next level of medication that people get onto is I'm going to remember. They're called barrier medications, and they're like Pepto-Bismol. There's a medication called Carafate. And what they do is, if you have irritation in your stomach, what they kind of do is just cover up. They act like a Band-Aid on the area of your stomach where the irritation would be, and they block it from getting more irritated. Actually, Pepto-Bismol and Carafate are cool because they kind of act as a Band-Aid underneath which the healing can occur. And so it's a potential to do some good for people who are using it. Another kind of medication are H2 blockers, and those are basically, and what they do is they prevent acid from being formed in your stomach, and they're kind of similar to antacids. Actually, their H2 is like a histamine blocker, and those medications are things like Pepcid or Zantac or Tagamet, And their side effects could be cause diarrhea, they could cause constipation, they can cause sleep problems, they can cause headaches. Uh, Zantac was recently taken off the market because there is an additive in Zantac that can cause cancer, and it's been named in a class action suit because it's fairly dangerous medication, not because of the Zantac itself, but because of whatever's in the Zantac that causes cancer. It can cause ringing in your ears. It can cause you to have a runny nose, or it can even cause problems with urination. So the side effects of H2 blockers are pretty significant. The next group of medications that people take are called proton pump inhibitors. These are the more potent medications, and what they do is they block the enzyme in your stomach lining that produces acid. They block this enzyme called pepsin. And the medications are like omeprazole, Nexium, Prevacid. There's a whole bunch of different ones, and they should not be taken long term either. None of these medications should be taken long term. And what they do, they can cause headaches, abdominal pain, nausea, they can cause diarrhea and flatulence. But more than that, over time, when you've been taking them for a long period of time, they can cause problems with absorption. Now, your stomach was designed to help you uh, digest your food. And in Chinese medicine, the stomach is considered to be a pot. So you take in your food, and the stomach is kind of like the pot that cooks it. And then it is simmered in this pot, and the acid that's in your stomach is supposed to be kind of cooking your food. And when you don't have enough acid, then you can't break down certain things. Like one thing that you can't do is break down the bacteria that might get into your body through your stomach. If you don't have enough acid, you can't absorb, you can't make B vitamin, B12 actually, and you can't break down certain proteins. And so in the stomach is where the first part of the digestive process occurs. So when you're taking something like a PPI, which is a proton pump inhibitor, and you take it for a long period of time, certain nutrients will not get into your bloodstream. So like you may not be able to absorb magnesium. You may have a higher risk of certain bacterial infections in your small intestine. There's a bacteria called Clostridium difficile that can overgrow. So it's an opportunistic bacteria, and it can overgrow in your small intestine, and it can cause problems in your body. You can have a B12 deficiency because over time you haven't been able to absorb or break down the nutrients that cause B12 or that allow you to make B12. You could have increased risk of pneumonia, and they've even seen people who've taken it for a long time have an increased risk of dementia. So there's all kinds of potential long-term effects of taking PPIs, and I recommend that if you are on them for a long period of time, that you find a way to get off of it. So this coming week, next Tuesday, I'm going to be doing a webinar, a free webinar, talking about how to figure out what type of heartburn you have. And in my world, again, doing Chinese medicine, there are 4 different types of heartburn. And I'm going to talk about those, and I'm going to teach you more about the medications that people take and what the side effects are, and how to learn what type of heartburn you have and then what to do about it. So I would love for you to join me next Tuesday night. There's the invitation right there in the sidebar, and join me for a free webinar that will teach you about the different types of heartburn and what to do about it. I look forward to seeing you there, and thank you so very much. I hope you have a great evening. Take care. Bye-bye.